Dr. Rodman here, and today I want to talk to you and show you some examples of why most patients who want brow bossing reduction need a type 3 brow bossing reduction. Now, if you saw our video yesterday, you saw there's two different kinds. Type 1, just burr it down. Type 3, actually remove the anterior table of frontal sinus and set it back. Now, for example, look at this patient. So this area up here, that's the frontal sinus. It's very bowed out. It's very well aerated. Now, that bone in the front of the sinus there is so thin, it cannot be burred down safely without risking the integrity of the frontal sinus. The only way to reduce that big forehead bulge is to actually remove that bone, reshape it, put it back on in a different and more recessed position. Now, here's an example of two different sinuses compared to each other. This up here is an aerated frontal sinus. This is a non-aerated frontal sinus. And now this only occurs about 1 in 20 patients. So only about 5% of patients qualify for a type 1 brow bone reduction. As you can see, this bone is nice and thick. This I can burr. I can burr it down until it's fat, until it's smooth, get a really nice result without having to actually remove the bone. But this one up above, the only way to make that smooth and flat and have a nice contour there is to actually remodel that bone. Here's just another example from the front. So this is showing, like, these are the two eyes. This is an aerated frontal sinus up here. This is a non-aerated frontal sinus, meaning just this whole area is bone. This can safely be burred down. This cannot. And just in case you were curious, here is an example of a brow bone reduction type 3. So in this example here on the left, patient has a bulging frontal sinus, heavy brow bone. The bone is actually removed, changed in shape, changed in position, set back, and held in place with two little titanium plates. So you can see that the bulge here at the brow bone is significantly reduced in the later picture. I sometimes have patients come to me and say that they've gotten another opinion and someone else said that they would be able to just burr it down. This is actually an example of the patient that you saw in the first picture. This kind of a brow bone with that much aeration of the frontal sinus just cannot be safely fixed without doing a type 3 brow bone reduction.